Gina had had an accident at our barn. One of the horses ran her over, and she unfortunately got trampled and slammed her head back on the concrete in the barn.
When the weight ratio is out of your favor, the 1,000-pound animal versus a 100-plus-pound person, yeah, she ran over the top of me and had one of those little scrunchies in the back of my hair. And down I went in the concrete floor of the barn.
So she had suffered a fairly severe head injury, and it took her a few days before she actually woke up. And in the meantime, since she didn't wake up and we couldn't talk to her and see what her brain injury was like, we actually put a pressure monitor into her brain to indirectly measure the pressure in her brain. And over the course of the next few days, she actually came around and woke up.
So when I first met Dr. Haque, he had come to tell me, the extent of her brain damage and injury, what was going on inside her head, the procedure in which he was going to use to try and help her. He was very cordial, very concerned about her, listened to my questions, answered my questions, put it in a term in which I could understand it, which made things a lot easier for me. He didn't hold anything back, he told me the truth.
She had fairly diffuse brain injury, basically areas of bruising on her brain, also blood clots on the surface of the brain, a lot of things happening in a lot of different parts of the brain.
Once she came out of a coma, we realized that she had a prior injury in her back, and after that, the coma, we realized that the injury was worse. She could not sit down. Her pain was 24/7, couldn't lay down, couldn't sit down, couldn't walk.
And he was the only doctor after seeing orthopedic surgeons and this, that, and the other. He goes, I can fix that. So he walked out of the office, and less than 60 seconds later, my husband and I are like, let's do it.
So she had a herniated disc in her lumbar spine. So basically some part of her disc had pooched out from where it shouldn't be and was pushing on one of the nerves going to her legs. And we surgically went in through a small incision and took out that disc that was protruding.
And she has not had a back pain since. She's really done real well.